what's fluid mechanics?
No, not really. No, sorry.
No, sorry. I don't know what that is.
I don't know.
No.
No. No. I don't know.
I don't know.
All of the people we asked doesn't have any idea about fluid mechanics. So we asked for an interview with someone who is expert in that field.
We have here Dr. Estrada, a general and cancer surgery doctor, to explain to us the concept of fluid mechanics on the medical field.
The first question is that how does fluid mechanics work in the heart?
There is a condition of increased heart pressure that will lead to hypertension. That is my evaluation as far as your question is. Pero generally, the mechanics, the blood that goes to the right side of the heart is generally venous, unoxygenated, in parentheses, no? It goes to the right side, right ventricle, the right upper chamber, then to the left ventricle. From the left ventricle, there is a very big blood vessel that goes to the lungs, which is the pulmonary artery. But that blood vessel, being an artery, does not contain arterial blood, but unoxygenated blood. That's why it's directed to the lungs for oxygenation of the blood there. And then the blood that goes back to the heart via the pulmonary vein is arterial in nature. Left upper chamber of the heart is the left auricle, and then down to the left ventricle through valves, and then out to the biggest blood vessel, the aorta, to the rest of the body. Yun ang blood flow, the mechanics.
Next question. Can you explain to us what happens during medicine intake? Like, where does it go and how does it work?
Okay. Intake, when you say intake, oral.
Yes.
Yes. Somehow, when you swallow it from the mouth, it passes through the
So,
food, what you call the esophagus, that connects the lower part of the mouth to the stomach. And from the stomach, it is absorbed. It depends upon the kind of medicine. Just like in iron, no? Ferrous sulfate is not very absorbable as far as the iron content. But if it is ferrous fumarate, it is more readily absorbable. So it depends upon the kind of medicine. Sa kwan yun, sa until the stomach only.
The next question is that what happens when the medicine is injected inside our body? Like, how does the medicine flow, or does this affect the flow of the blood of the
It
patient?
depends what you say the medicine is given to the body. There are several routes. One is intramuscular. It is absorbed quite slowly if it is intramuscular, no? And then if it is only subcutaneous or just below the skin, just for testing, just for like antibiotics, whether you are allergic to it. But if it is given intravenously, you don't give or generally you give the medicine as low as possible. The only time you give a medicine as fast as you can is in cardiac arrest, sodium bicarbonate. You give it as fast as you can, so you revive the heart. But generally, there is no instance or condition where you have to give it fast. For one, like in antibiotics, it can cause phlebitis, yung mainit or mamamaga, or if it gets out of the vein, the more so it will get inflamed. That's the only time. Kaya, as I said, it's only when there is cardiac arrest, the heart has stopped literally. That's why you want to revive it, the patient, you cannot revive an acidotic heart. You give sodium bicarbonate. That is, I think, about 50 milliequivalents. And it's a big ampule and a big syringe and a big needle. Now, the needle, when the number of the needle goes down, the bigger the size of the hole of the needle. If you say gauge 26, 27, 28, it's just like the hair, our hair. But if it is gauge 18, that's about 1 centimeter already. Yung kanya, the needle diameter, not the syringe itself.
How does fluid mechanics work in the brain?
As far as the brain is concerned, fluid, no? Yung newborn, yung malaking ulo, hydrocephalus, we call it. There is what we call increased intracranial pressure when there is hemorrhage in the brain. Now, the water in the brain is called the spinal fluid, no? And the blood and the spinal fluid cannot mix in the ventricles. Merong ventricles din ng brain eh. The prognosis for a patient to live when there is a mixture of the blood and the spinal fluid or the cranial fluid is very poor. Very poor. Kaya yung what we call yung spinal tap, you get a sample. If the pressure is quite high, yun. And the tap is what we call bloody, not due to your trauma, no? But really in the spinal canal, it's bloody. That's quite a poor prognosis for a patient to live. And you cannot, in increased intracranial pressure, you cannot get spinal fluid fast and a big amount because the brain stem will herniate, yung bang sisiksik in layman's dito sa pinaka-leg natin, yung maliit na butas, foramen magnum doon. And the brain stem contains all the vital centers. When we call the vital centers, respiratory center, yung itong sa circulatory system center, lahat nandyan. That's why when it herniates, yung sumiksik doon, the patient is practically, in this stage, you label a patient as dead when there is no brain waves. Dito sa atin, heart. But a patient can have no heartbeat and yet the brain is still alive. Merong what we call EEG. In EEG, electroencephalograph, compared to an electrocardiogram, no? Or cardiograph, where you have these tracings in the waves. As far as the neuro yan. Sa euro, you have at least 30 cc's of urine per hour. That is the normal. Now, if it is in patients na below the normal or what we call oliguria, on the average 600 cc's in 24 hours, you give a test of 500 cc's in about 30 minutes in patients with a good cardiac condition. Walang heart problem. No heart problem. Or young or middle age. But not in elderly. If you give them fast, they will drown. You create an artificial or a medical term we call pulmonary congestion. There is more fluid in the lungs than the normal, or that is precursor of a very fatal condition, pulmonary edema. Once a patient is diagnosed to have pulmonary edema, that's very poor. Nandun ang fluid, inside the lungs. That is different from fluid inside the chest but outside the lungs. If there is fluid inside the chest wall and outside the lungs, in fluid, we call it hydrothorax. We just put a needle and suck it out. Or kung marami, if it's moderate, 500 cc and above, you put a tube. If it is blood, because of stab wound, we call it hemothorax. But that tube should be underwater, the tube. Why underwater? Because the pressure in the chest is negative. Atmospheric air will just go into the chest and it will collapse. Unlike if the tube is deep into the water, you will see bubbles there. It will bubble. That means there is still air in the lungs, inside the chest or outside the lungs, or the lungs has a punctured wound or perforation. But the atmospheric air will not go inside. But the mistake of some nurses or even doctors, when they carry that chest fluid, yung tip of that tube is deep into the water, and then you break the bottle, or the water or the bottle say stumbles down, atmospheric air will go into the chest wall, and it is quite fatal because the lungs will collapse because of atmospheric air. Yun, yung fluid, that is far as say fluid inside the chest cavity, outside the lungs. Fluid inside the lungs is called pulmonary congestion or pulmonary edema, which can be cured only by giving slowly yung diuretics and some medications as far as the cardiologist is concerned.
One good example of what Dr. Estrada explained is a scene from The Good Doctor.
Incision should take place 2 ribs down.
Okay, well, why the bottle?
The air will continue to leak and accumulate until the damage can be properly repaired. The tube allows the air to get out, the water in the bottle stops the air from coming back in.
A homemade one-way valve. He's breathing. You saved his life. He saved his life.
Do burns have connection with fluid mechanics?
Sa burns, it's very critical that you give replacement of blood and fluids. The first 24 hours, fluid. The first degree burn, the best example is sunburn. First degree. Second degree is fatal because you lose a lot of fluid. Nasunog, wala lahat yung balat.
How does fluid mechanics work in the eyes?
The fluid in the eyes, no? There is a circulation. If it is increased pressure in the eyes, that's glaucoma. It can lead to blindness, acute glaucoma. Fluid also in the ears, in the semicircular canals. Pag imbalance yung fluid ng semicircular canals, diyan ka nagkakaroon ng yung vertigo, we call it, na nahihilo ka, or your surrounding ang umiikot. Meniere's disease, we call it. Yan, the fluid equilibrium in the ear should be balanced among the horizontal, the vertical, and the oblique semicircular canals in the ear. Sa eye, ganun din yun. There is the anterior chamber and posterior chamber. If there is increased ocular pressure, we call it glaucoma. It depends whether it has an acute angle or depends upon iba na yan. I cannot elaborate too much on that. But that is as far as in the eyes.